Welcome to the Rehab Roundup. I'm your host, board certified physiatrist and independent practice owner, Dr. Hassan, helping physiatrists build profitable businesses so that they can achieve financial independence and live without limits. Welcome back to the Rehab Roundup. For those of you all who are joining for the first time, thank you. And for those of you all who are coming back, I appreciate that. Today I want to talk to you about one of the best kept secrets in rehab. What that is acute inpatient rehab. I know some of you all may be shocked because you didn't necessarily think that was the case, but I'm here to talk to you about my experience and kind of explain to you why I believe that is the case. As physiatrists, we can practice in many different practice settings. Outpatient, we can do interventional pain, we can do inpatient, we can do sniff. But for me, I think acute inpatient rehab is the best kept secret. One of the reasons why I think that is, if you think about it, the patients are stable for the most part, and they aren't really going anywhere. Average length of stay in acute rehab is 10 to 14 days. So if you think about it, you have 10 to 14 days to kind of see the patient, take care of the patient, and transition the patient back home, a lot of times with good results in restoring their function, which is what we do. Another thing is you don't have to worry about overhead. A lot of times in acute inpatient rehab, be it a unit or a freestanding hospital, everything is pretty much taken care of for you. If you need to dictate, they have a transcription service or they have Dragon. If you need a medical record, they have an EMR provided for you. And staff is already there. So really, you're going in and seeing a patient, making sure any rehab-related issues are addressed, and you go about your business. Now, some of this is contingent on where you practice and how your rehab unit or hospital is set up. And we can kind of talk about that further in terms of me giving you tips or pointers on how to set it up in the most ideal fashion to make sure that you create a win-win situation where you're there focusing on the rehab related issues and some of the medical things are kind of being addressed so that you're not bombarded with both rehab and medicine. But those are really big, huge reasons why acute inpatient rehab is really ideal. Also, you take into account the billing component in terms of the different codes that you can use to kind of maximize revenue. So I know sometimes, depending on what your residency experience was, you might kind of be turned away, or depending on some of the situations or opportunities that are provided out there, may turn you away, kind of lead you down alternative paths, be that outpatient, interventional pain, or skilled nursing. But I think acute inpatient rehab is really a good space to be in and practice in. So one of the best kept secrets in rehab, in my opinion, is acute inpatient rehab. If you have any questions, you can definitely reach out to me on social media at Dr. Hassan Rehab, DrHassan Rehab. We can kind of pick up the conversation. I can give you some tips and pointers about how I've had situations set up in the past, certain areas, and certain rehab providers that can help put a really good infrastructure in place to really make acute inpatient rehab the best kept secret and a great place to practice. Thank you for tuning in to the Rehab Roundup. I am Dr. Hassan, board certified physiatrist and independent practice owner, helping physiatrists build profitable businesses so that they can achieve financial independence and live without limits. Thank you again, and good night.